Turning 65 and understanding the different parts of Medicare. Hi guys, my name's Mason Jackson. I'm with Midwest Savings Network. I just want to say thanks for stopping by and watching the video. Chances are, if you are watching the video, you are turning 65, so congratulations. But I know two things that are probably going on. One is your phone has been ringing off the hook or ringing nonstop, and it probably started about 3 months ago, and you're actually considering changing your phone number. And two is your mailbox. Your mailbox is also just blowing up with mail pieces from different agents and different companies trying to explain to you Medicare and the different supplement plans that are out there. It is a true, the true meaning of information overload. So if you're like most of our clients that just came to us and said, hey, we need help, just somebody make sense of this for us. So what I wanted to do was just shoot this short video explaining just the basics of Medicare and how they pertain to you, and then also make a short video of the Medicare supplements and how they work. So let's jump right in. All right, guys, again, I'm going to try to make this as easy and simple to understand. Now, with Medicare, you have what's called an initial enrollment period. This is the time period that you have to sign up to receive your Medicare benefits. This period actually consists of 7 months. It's the 3 months before your birth month, and the 3 months after your birth month. Now, I tell people don't put this off because you got to remember you're working with the government and they don't work at the speed of light. So also too, if you miss this period, you could incur a penalty, and also you could delay the time period in which your coverage or your benefits actually start. So we have all of our clients sign up during the first 3 months before they turn 65. That kind of allows the process to move a little bit smoother, and then it also helps for when they pick out their Medicare supplement. Medicare is made up of 4 parts. You have your Part A, Part B, Part C, and Part D. And again, guys, I'm going to make this as short and sweet and as simple as I can. Part A is considered your hospitalization. So just think of this as any time that you have a stay in the hospital. Now, with Part A, you do have a $1,408 deductible that has to be met before your benefits actually kick in. Once your deductible has been met, then Medicare will pick up the first 60 days while you're inside the hospital. So day 1 through day 60, you are going to pay nothing. Medicare is going to pick up that whole tab. Day 0 through 60, Medicare pays for. Now, starting with day 61, you are actually responsible for $352 per day. All right. And then as the longer you stay inside the hospital, anything after day 91, you are actually responsible for $704 per day. All right, so let's hope that you don't have a long extended stay inside the hospital, but if you do, that kind of gives you an idea of how your Medicare Part A benefits work. Now, one thing to note is that deductible is not an annual deductible. That is a per benefit deductible. So if you were the unluckiest person, you could have up to 6 benefit periods. Part B is your outpatient treatment. Now, this is going to be mostly consist of your doctor office visits or any of your diagnostic testing that you have done outside of the hospital. Now, Part B also has a deductible, and that deductible is $198. All right. Now, this, unlike the Part A deductible, the Part B deductible is an annual deductible. So that only has to be met one time before your Part B benefits can start to kick in. Now, once you've met your deductible, you and Medicare are going to split all approved claims 80-20, with Medicare paying the 80% and you paying the 20%. All right. So as you can see, with Medicare Part A and Part B, there are some gaps, and that's where your Medicare supplements come in, or your Medigap policies come in, and we'll cover that in a later video. Now, One thing to note, that Medicare Part A and Part B are considered original Medicare. And what I mean by that is that is pretty much accepted everywhere. Almost 98% of doctors take Medicare and Medicare assignment. So there are no networks, there are no pre-authorizations. Medicare Part C. Medicare Part C is usually referred to as Medicare Advantage. Now this is going to be just the flip side of original Medicare. So if you choose Medicare Advantage, you are basically stepping outside of original Medicare and allowing for a private health insurance company to run or manage your health care. All right, and it will include your inpatient, it will include your outpatient, and they also combined your prescription drugs. But one thing to note with Medicare Advantage, there are networks, there are pre-authorizations. So if you choose Medicare Advantage, before you choose your plan, you need to make sure that your doctor is in the network, your hospitals are in the, your hospital is in the network. You need to because if you go outside of their network, it is going to, you are going to incur a penalty, or sometimes you may be responsible for the full amount. Okay. Part D is simply your prescription drug plan. Most people sign up for their drug plan at the same time as they sign up for Part A and Part B. Now, the best way to find the drug plan that works best for you is one of two ways. You can gather up all your information and call Medicare yourself at 1-800-MEDICARE. If you do that, just note that you try to do that in the evening. Medicare is open, that phone line is open 24/7. So during the day, they are really swamped. But if you try the evening, you should be able to get right in. But if you gather all your information, or gather all your medication that you're taking, and you give that to them, they'll be able to put that into the computer and tell you which one is going to be the best drug plan for you in your area. Now, if you're a little bit computer savvy, you can actually go to medicare.gov and you can actually put in the medication yourself, choose the pharmacy that you're going to be working with, and then it will give you a list of all the drug plans that are in your area. Now, one thing to note, the cheapest drug plan is not necessarily the best drug plan for you. You actually have to get inside there and look and see how some of the drug plans may not cover your medications, or some of your medications may be more expensive in other drug plans. So you got to look and really make sure that your drugs are going to be covered inside the drug plan that you choose. So when you do, if you happen to get on the website and you see that there is a $13 plan, just don't pick that plan. You actually have to go inside there and look and see, hey, what's my medication going to cost me inside that drug plan? Okay. Well, there you have it, guys. Hopefully this video was able to help you make a little bit more sense of Medicare and the different parts of Medicare. So the next video that we're going to go over is, like I said, you can see that there are some gaps